Dr. Z joins us today. We're talking about fillers and where to replace the volume in your face.
Yes, yes.
So we have a bunch of fillers here today.
We do, and I'm actually going to squirt some out on my hand so you can see.
Okay.
But what is a filler, and why do we choose to use it? Well, you don't know yet, but you may one day. As we age, we lose volume in our face. We lose bone, fat, collagen.
So and things kind of start to drift
that
down.
balloon kind of deflates, and then we have wrinkles that show.
No,
those wrinkles. But there are ways. So women in our late 20s, that starts to happen, and then men in their late 30s. But
they got till their 30s.
No, 10 years
That's not
later,
fair.
a decade later. What's the deal? Well, so the good news is we do have things pretty much non-invasively. It means there's no downtime. You may have a little bruising. Fillers can replace volume. So as we age and we lose the volume, we look older.
Okay.
There are all types of fillers, and I brought some here. And the ones on this side, Radiesse here, and then Sculptra down in the red box, those are non-reversible fillers. So these two,
permanent.
Well, they're not permanent, but
Okay.
they're longer lasting and they're not reversible. And they have their
does that
place.
mean if you stick it somewhere in the wrong place, you have a problem? Okay.
Yes, exactly.
Okay.
Which is why for initially, I like to use what we call a class of HA fillers, hyaluronic acid fillers. And those are a very soft, like gel consistency. And so I am going to just show you. And it's clear, as you can see. So it's a clear gel. And I'm going to squirt some on my... Can you see it coming out there?
Yeah.
And then it's kind of like Jell-O.
It is.
Like a not so firm Jell-O. And this is actually a catheter. See how it's not puncturing my glove? It's not sharp, it's blunt. And we just lay down lines of this filler wherever it needs to go.
So that goes on top, it goes on top
It
of
depends.
the skin. Okay.
It goes within the skin. It doesn't lay on top of the skin. So I make an opening with a needle or
I see.
and then I go through that opening with the catheter so that you have less bruising that way. I don't use the needles except in certain areas, but I use all of these fillers. And what you really need to know is what concerns you. We used to just chase the wrinkle and fill the wrinkle, but now we choose to treat the cause of the wrinkle or the reason for the wrinkle. And it's volume replacement all over. So we may go here in the cheeks, we may here in the jawline. And it was interesting because I had an opportunity to go to Paris for filler training and sharing what I do with other physicians around the world. It was a big honor last month. And it was interesting to see how Asians see a beautiful face. They want their cheeks to go into their neckline, blend in. They do not want a strong jawline.
Okay.
Men, we want a strong eyebrows, strong jawline, strong chin. So beauty is in the eye of the beholder, but there are definite I guess, basics when you see different areas.
Okay, and I know we had a lot of questions online talking about, one of them was over-the-counter creams.
Oh, we have a lot. And the most important thing is make sure your doctor's board certified in this. It can cost between $500 and $5,000. That's a liquid facelift, if you will. If you haven't had anything done over the years, you're going to need more. Most common side effect is bruising or too much or in the wrong place. So make sure that whoever you're using is board certified and they're an artist, because there's nothing worse than seeing it in the wrong place. You know when it's wrong, but you don't see is when it's good. And so there's a lot of good fillers walking around out there. Okay, so Facebook questions.
Right.
I love it. What over-the-counter products actually work for reversing fine lines and wrinkles? None. Zero. There are none. Now, really, what they help minimize them a little bit, but really, if that were true, we wouldn't have any wrinkles walking around and all those, because we have tons of jars and creams. Women, we buy like crazy, but they don't really work. They help minimize the appearance by moisturizing. But the only real ones I like over the counter have a retinol in them.
Okay.
And ROC, and I put that down on the post. So I like ROC, ROC,
Okay.
And it has a retinol that is very well made over the counter.
Dr. Z, I know we've got to get to
Yes.
a basket. We've got a basket today, a gold glitter
Yes.
Santa sleigh. Check
Yay.
this out. And we have changed the rules a little bit because we've had a lot of repeated winners. You can only win one basket a year. This is
Yes.
a $200 value and includes sunscreen, hand cream, some body wash, and moisturizer. It's for caller number 10. Call the number on your screen, 225-336-2321. Now remember, the rules have changed. That's one basket per person. And for a copy of the rules or details about the basket, we have that posted on our website, wbrz.com. And for more information on how to restore the volume in your face, head on over to our website, and we have all that information, including Dr. Z's information, posted right there.